start our time scenarios. And I've got another cheer for us. So go look in handouts if you haven't already done so. Download this, print it out if you'd like to. If not, you can read it right from the screen. Let me know in the chat when you're ready.
Okay, looks like they're ready, Miss Shirley.
We're ready, yeah. So how about Mrs. Audra, we unmute everybody. So we'll start to hear some background sounds. Mrs. Audra, it's not letting me go any further with this. Are you working from the top?
Mommy, no,
Are we all unmuted, Mrs. Audra?
Mommy, I don't
Give me one moment,
Miss
please.
Audra.
Mommy, I want to eat a piece.
Okay, so I saw for you, so I'm not going to be able to.
Eat your food or go to bed.
Pretty much everybody.
Are we ready?
I think we are, yeah.
Okay. Everybody listen up. If you would stand up, because we've been sitting for quite a while, we need to shake up our brains. So stand up, move around a little bit, and we're going to do just a rhythmic kind of renditions of this, okay? It's a cheer. So here we go. On my count, 1, 2, 3. We're digestive coders from AMCI, coding pertains and soap stars from CSI.
Transplant.
Activities we code with these, coding UTIs, is a breeze. Digestive accelerators, woohoo! We can do this. Let me hear that. Let me hear we can do this.
We can do
this. Woohoo! Awesome. Are you all awake now? Ready to dig in?
Yes.
Yeah, I thought so. Okay, Mrs. Audra, we're gonna get everybody muted. Ah, it got awfully quiet, didn't it? And here we go. So here's our first scenario. Mrs. Audra, can you read it for us, please?
Okay, so we have A, Hartman's procedure, B, Kasai procedure, C, Whipple procedure, or D, Meckel's procedure. What is the eponym for pancreatoduodenectomy?
And let's do 2 minutes for this.
All right, 2 minutes beginning now.
Thank you. And coders, put your answers in the chat for us, please.
Okay, time is up.
Thank you, Mrs. Audra. I see a few different answers in the chat. Some of you gave us keywords, which is awesome. Let's take a look. When I look at these, you know, unless I happen to know, I'm not going to know what these are, I don't think. So C is our correct answer, and a lot of you got this. Keywords, epinin, pancreaduodenectomy. Now, this is something that I happen to know it from Grey's Anatomy. They were always wanting to do Whipples, and I knew that that had to do with the pancreas. But let's say I had no clue. How might I find this out? I'm at the board exam, just have my books. I can take a little bit of time to check this. So I go look. In the index, these are all there. Okay? So let's take a look. Every one of these, if we look, the name is right in that code description. Okay, now if we look at A, colectomy partial with skin level cecostomy, or no, I'm sorry, reading it wrong, with encolostomy and closure of distal segment. So no mention of anything about removal of a pancreas or the duodenum. B, Kasai procedure, portoenterostomy, different procedure. Obviously, Whipple, we got the pancreas, we got the duodenum, and it literally says Whipple. Meckel's, here we have Meckel's diverticulum. Okay, so that's a way that I went to try to figure this one out. You know, any of these that you can get in your head's going to help you. I don't know if you'll have questions on this on your board exam or not, but sometimes scenarios do mention Whipples. So I think it's wise for you to know that one. Any questions for me? Any comments? The chat box is empty. It is quiet, rather. Okay, move on. Okay, I do see a question there. Go to index. That's what I did, Sika. I went to the index. Brenda, I don't understand your question. It is not listed as such. What is not listed as such? Okay, yeah, you couldn't find this term. Okay, but it's under Whipple. Another good reason to know Whipple. It's listed in there under Whipple. Yeah, I couldn't find it under pancreaduodenectomy either. That would have been a real fast way to find this, wouldn't it? But I couldn't find it either. You're right, Brenda. Okay, moving on now. Mrs. Audra, can you read this one for us, please?
All right. So we have A, K80.21, Z01.89, I10, B, K80.20, I10, Z01.810, C, Z01.810, K80.20, I10, or D, I10, Z01.818, K80.20. A patient with hypertension is scheduled for same-day surgery for removal of her gallbladder due to chronic gallstones. She is examined preoperatively by her cardiologist to be cleared for surgery. What ICD-10 CM codes are reported by the cardiologist?
Thank you, Mrs. Audra. Let's do 2 minutes for this one.
All right, 2 minutes, beginning now.
And coders, remember your keywords.
Okay, time is up. Mrs. Shirley, we can't hear you.
Oh, I was muted. Oh, so sorry about that, coders. I saw in the chat we have a few different answers. We have awesome keywords, and now we're going to take this all apart. And when I look, C is our correct answer. When I look in my answers, we have K80 codes in A, B, C, and D. We have Z01 codes, A, B, C, and D, and we have I10 codes in every code, just as it is. So, got to sort this out. Sequencing may be an issue here, and certainly differences between codes that are really close together. Here's my keywords: hypertension, removal of gallbladder, chronic gallstones, preoperatively, cardiologist, cleared for surgery, and we're coding for the cardiologist. Okay, let's look at some codes here. Here we see K80.20, calculus of gallbladder without cholecystitis, without obstruction. It's a good code for this. If we look at K80.21, calculus of gallbladder without cholecystitis with obstruction, and our scenario doesn't talk about obstruction. So with that, I'm eliminating answer A. It just doesn't work. Now taking a look, I10 is in all of them. We don't have to think about it whether it belongs there or not, but I brought it for anybody that's not familiar with the code. I10, essential primary hypertension. You know, in everyday life, we call that high blood pressure. Now, let's look at these Z codes. We have a few of them. Z01810, encounter for pre-procedural cardiovascular examination. Liking that. This was definitely pre-procedural. She's going to have surgery, and she's being seen preoperatively by her cardiologist, so this is a cardiovascular exam. That strikes me as a very good code for this. Z01818, encounter for pre-procedural examination. Not very specific, is it? And we have a specific code. Oh, encounter for other pre-procedural examination, and we've got what we need here, so we wouldn't use that. So I've crossed that out, I've eliminated D. Now looking at Z0189, counter for other specified, can't use that either. Okay, just doesn't work. So I've got now, sorry, I moved too fast. I've got now these two answers, B and C are possibilities. B, take a look, K80.20, 80.20, first listed second. I10, in the middle, at the end, Z01810, at the end, at the beginning. So we do have a sequencing question here that we've got to sort out now. And when you're dealing with C codes, there are some that are used as first listed. And this handy chart is in our books to help us out with this. And here's our code, Z01.810. Okay, and that's exactly the first code in our correct answer. This is from a different publisher. In our books, our AAPC book, if that's what you have, it's Appendix B. They vary what they put in these different appendixes, and it's on page 1281. And I would like you to take a look at that if you have your AAPC book handy, because I want you to be sure that you understand this, that you know that list is there. So just take a quick look, page 1281, and you go down far enough and you will see Z01.810. 810. It's there. Any questions about that? Or are you good? Okay, no questions. So just going back to look at the whole thing here. Okay, we've eliminated B now based on sequencing. Do you get this? Is this good to go? Tell me in the chat. Oh, you know what? My chat had frozen. I couldn't see anything that you guys have been saying.
Okay, Brenda says she wants to know that page again.
Okay, it is page 1281 in the AAPC book. Sika, you want to take a picture? Is it the scenario or is it the Z-code chart? What do you need? The Z-code chart. Alrighty. Oops. To go backwards, forgot that. There you go. And Trupti question, when we get any scenario and we can use this, well, it's got to have a Z code. And if you think about it, this code is the reason for the encounter, which typically is our first listed code when we're in ICD-10. Okay. Question here, we have a newbie. Vicky, welcome, welcome. I'm so glad you came tonight. Her question, in case anybody else is new, this is her first time joining. Should she see what others are putting in the chat? No. Instructors see that, but our students don't, Vicky. You know, what you put in the chat is between you and your instructor. When you say things that might help another student, we certainly will read them. And when you have a question, we'll read them and do our best to answer.
Okay. We have one question that says, does the Optum have that chart?
I honestly don't know. I don't have an Optum book. I would hope so, or in some way would have that information for you. But if you have an Optum book, you know, you need to take the time to really get to know your books. So, you know, go look for it. Oh, and we have another newbie, Fatima. Welcome, welcome, welcome. I am so glad you came tonight. Do we have any other newbies here? We have Vicky and Fatima. Anybody else? Okay, I guess that's it. All righty. Can I move on now? Do I know that the AMA, yeah, this clipping is from the AMA book. What you see on your screen is from the AMA book. Now I have access to an electronic copy of it. I don't have a print copy, so I can't tell you what page it's on because the pagination's different in the electronic and the print copy. Page doesn't match. In the AAPC book, Sika? Right, I don't know. Yeah, okay, Sika's saying the AMA book. Exactly. Every publisher's book is different. And so the page that I gave you, let me bring it back, was for the AAPC book. Anything else? Questions, comments? Yes, Mildred, correct. It's Appendix B in AAPC. In AMA, it's Appendix E. Anything else? Are we ready for the next scenario? I think so. Yeah, yeah, I agree. Okay. Here we go. Yeah. Okay. Okay, I'm giving you my keywords. I'm so sorry about that. Mrs. Audra, can you read this one for us?
All right, so we have A, 43621, 43635. B, 43634, 43635. C, 43633, 43635. Or D, 43633, 43640, modifier 51. What is the correct CPT code for a partial distal gastrectomy with Roux-en-Y reconstruction with vagotomy?
Thank you, Mrs. Audra. Let's do 2 minutes for this one also.
2 minutes beginning now. All right, time is up.
Thank you, Mrs. Audra. I'm checking out the chat. I think everybody came up with the same answer. And the keywords look great. Looks like everybody came up with C, and you know what? That is our correct answer. So let's just take a look. I'll read over the keywords. You guys have seen this the whole time. Partial distal gastrectomy, Roux-en-Y reconstruction, vagotomy. Okay, and here's our code descriptions. Starting out, we've got 43621 gastrectomy total, and we're going to eliminate that because this is a total and we're talking about a partial distal gastrectomy, so can't use that. Now looking at 43634 gastrectomy partial distal with formation of intestinal pouch. Nothing there about an intestinal pouch, right? Right, so we can eliminate that one. Now taking a look at the second code here, vagotomy when performed with partial distal gastrectomy, that's a good code for this. Going to hold on to that one. Let's look now at 43640, vagotomy including pyloroplasty, and that didn't happen, so got to eliminate that one, which takes us back to C, and we have gastrectomy partial distal, a match, with Roux-en-Y reconstruction, a match, and then it's followed by 43635, vagotomy when performed with partial distal gastrectomy. So that's our correct answer. Now everybody that answered got it correct, and a lot of you answered this one. But please tell me, do you have any questions for me? Or are you good? Good. Looks good. Somebody comments she found this one easy, and you know, some of them are harder than others, and sometimes what's easy for someone's harder for somebody else, so it's good to have a mix. Okay. Yes, Brenda's making a good note here. The parenthetical confirms the first procedure, and we have used 43635 in conjunction with 43631. 43632 and 33 and 34. So yes, you're absolutely right on that. Right on target, Brenda. Great that you're reading that. Here we go. Okay, Mrs. Audra, you're on.
All right, so we have A, 43831, D, 49.0, F, 10.10, B, 43870, C, 15.8, F, 10.99, C, 43653, C, 15.9, F, 10.20, or D, 43830, C, 15.3, F, 10.20. What CPT and ICD-10 CM codes are the creation of opening in the stomach to insert a feeding tube for nutritional support in an adult patient with proximal esophageal carcinoma due to alcohol dependence. A gastric tube was not created.
Thank you, Mrs. Audra. Let's do 2 minutes once again.
Okay, 2 minutes.
Thanks, and remember your keywords, coders.
And time is up.
Thank you, Mrs. Audra. Let's check out the chat. Great keywords, coders. Couple different answers. Okay. All righty, let's take a look. The CPT codes don't help me a lot. I notice here I've got a code starting with D, and down here these all start with C. That might be significant. F codes tend to deal with mental health issues, so that might have something to do with the alcohol dependence, but there's nothing in here that points me in a definitive direction. D is our correct answer, so kudos to those of you that got that one correct. A lot of you did. Here we go. Creation, opening, stomach. Insert feeding tube for nutritional support, adult patient, proximal esophageal carcinoma, alcohol dependence, gastric tube not created. A lot of keywords here to make sure we keep. Okay, let's look at these codes now. We've got gastrostomy without constriction of gastric tube. We're looking at 43831 now. Neonatal for feeding. Tell me in the chat, does that work and why not? What do you think? Awesome. Yeah, a lot of you are saying because this is for a neonate, which would be an infant, and we know that our patient is an adult. We don't know the patient's age, but we know that our patient is an adult. So that's a great reason to not go with that. We just can't use that code at all. Okay. 43753, gastric intubation and aspirations, therapeutic. Did that happen? I don't see anything, right? Yeah, you got this. No, that didn't happen either. There wasn't any mention of intubation or aspiration. Now, 43870, closure of gastrostomy, surgical. Does it talk about a closure or a gastrostomy? Right, right. Okay, so it's not just a closure, so that's not going on either. And if we look now at 43830, gastrostomy open without constriction of gastric tube, without construction rather of gastric tube. Perfect. So now let's look at the ICD-10. We have C15-3. So we're looking here at malignant neoplasms of esophagus, C15-3, malignant neoplasm of upper third of esophagus. And here we have this patient has proximal esophageal carcinoma. How do I know that this is correct? Upper third and proximal, do they mean the same thing? Tell me in the chat. What do you know about that word proximal? I have one response. Yeah. Okay. Yeah. Proximal. Yes. Upper. Yeah. Yeah. Upper. And top third certainly is upper. So that's why we can get that with these esophagus codes. Sometimes they get very specific as to which third of the esophagus is happening. Now looking at the F10.20, alcohol dependence uncomplicated. There's no complications here, are there? You know, the patient is dependent, and that's a perfect match, but there's nothing beyond that happening. Right, Felicia, there's nothing else happening. So that leaves D as our correct answer. Have any questions for me? Do you get this one? I see a lot of got it's. Awesome. Awesome. Okay, coders, we're moving on. Okay, Mrs. Audra, can you read this one for us, please?
All right. We have A, 44950, K35.80, B, 44970, K35.80, C, 44950, R10.31, R50.9, R11.10, K35.80, or D, 44970K37. A 28-year-old female had symptoms of right lower quadrant abdominal pain, fever, and vomiting. She was diagnosed with acute appendicitis. The surgeon makes an abdominal incision to remove the appendix. The appendix was not ruptured. The incision is closed. What are the correct CPT and ICD-10 CM codes for the encounter?
Thank you, Mrs. Audra. Let's do 2 minutes again for this one.
All right, 2 minutes beginning now.
Thank you.
All right, time is up.
Thank you, Mrs. Audra. Some answers are still coming in, so just going to watch the chat for a few minutes. And coders, again, I see awesome keywords. You guys are mastering keyword concept. And that does my heart good. We're thrilled to see that. Okay, I see a few different answers here, so we got to really dig this one apart. Now, if we look, let's bring up the correct answer first. A lot of you got it. It's answer A. Now let's figure the rest of this out, okay? We've got two CPT codes to think about, 44950 and 44970. So that shouldn't be too difficult, and we'll be able to eliminate two based on whichever one of these is correct. We have some K codes. K codes are for what body system? Diagnoses, what kind of diagnoses? Kristen, you've got it. Yeah. Felicia, you've got it. Yeah, it's digestive. You see a K, you've got digestive. I use kaopectate, helps me to remember. So if we had some codes that started with a different letter, we could eliminate them, but we don't have that here. Okay, let's look at some keywords. 28-year-old, right lower quadrant abdominal pain, fever, vomiting, acute appendicitis, abdominal incision, remove the appendix, not ruptured. Okay, let's look at some codes. We've got 44950 and 49970, and look at what pops out. We've got this whole set are for excisions. This whole set is for laparoscopy. Tell me in the chat, is this a laparoscopic procedure or is it an open procedure? What do you see? Yeah. Ah, you guys are on tonight. You've got this. Awesome. Awesome. Kimberly, I like what you're saying here, and it gives me an opportunity to say something. You say doesn't specify laparoscopic, and that is true. It doesn't say it was done laparoscopically, but you know what it tells me? It tells me the surgeon made an abdominal incision. So when we've got an incision, we're talking about something that is not a laparoscopy, but it is an excision. Okay? Got that? All righty. So I've got to choose my code from this set, and if we look, 44950, appendectomy, they're both appendectomy, but we've decided we can't use, okay, Sika, good question. Incision means open unless it's a little teeny thing for laparoscopy, yeah. Generally, open means they've opened the body such that they can directly view what's inside. Okay? Does that help? Kristen, another great question. Do they say port when scopes? A lot of times you'll see that language. Yeah. Yeah. Okay. All right. You guys have great questions. I love it. I love it. Okay. So I'm going with 44950. Okay. That's real clear. So I can eliminate B and D just based on that. So now let's take a look before we move on here. Both codes, as we discussed, have 44950. Both have K35.80. The difference is these three codes that start with an R. Tell me, R codes in ICD-10, what are they for? Oh, you guys got this too. Hey, yay, signs and symptoms, absolutely. In this scenario, are we going to code symptoms? No, tell me why not. Tell me why in the chat. Why can't we code symptoms here? Kim, you got it. Brenda, yeah, right. Mildred, and so many people are saying because we have a diagnosis. When we have a scenario with a diagnosis and the symptoms that suggest that diagnosis, we are not going to code them. So based on that, that's out. Okay? So let's just take a look at K3580. Just to be sure, K3580, unspecified acute, and then here underneath it, it tells us acute appendicitis, not otherwise specified. And that's exactly what we've got in this scenario. So A is our correct answer. Any questions for me? I've got some got it's and I've got some no's. I'm going to give you a couple more seconds in case anybody's asking a question. It's looking good in the chat. Awesome. Okay. Troopty likes the red star. I do too, Troopty. I do too. Ah, there's another red star. Okay, Mrs. Audra, here's our next scenario.
Okay. So you have A, 91010, B, 91010, 91013, C, 91020, D, 91030. A patient is seen to have an esophageal mobility procedure with acid perfusion study performed. What CPT codes is or are reported?
Thanks, Mrs. Audra. Let's do 2 minutes again.
Okay, 2 minutes beginning now. All right, time is up.
Thank you, Mrs. Audra. And I see a few different answers in the chat. The keywords are right on target. All righty. Let's see what the answer is first. It is B, and congratulations to those of you that came up with that. And let's go and pull this apart and figure it all out. Keywords: esophageal motility procedure, acid perfusion study. Okay, here's our codes. Looking first, 91030, esophagus acid perfusion. There's one of those eponyms, acid perfusion test for esophagitis. Okay, we are missing anything about the motility study. We've got two things happening here. We have the esophageal motility, and we've also got the acid perfusion, and we need to code both of those. So D is out the door. Looking here at C, 91020, now we have the gastric motility. We're looking for esophageal motility. Okay, so can't use that one. Looking now, 91010, esophageal motility, manometric study of the esophagus and or gastroesophageal junction study with interpretation and report. It's a good code, huh? Is A, does that work, that answer, just A? Tell me why. Okay, Siki, you're telling me it's incomplete. Wow, okay, Kristen, you got it. Cindy, it's missing perfusion, so we can't take that one either. But if we look at answer B, 91010, this is the esophageal motility study, and the add-on code 91013 with stimulation or perfusion, for example, stimulant acid or alkaline perfusion. And in case we're not sure, we've got this handy parenthetical note. Use 91013 in conjunction with 91010. So that's a go. Is everybody good with this now? Any questions for me? Tell me in the chat. Awesome. Awesome. This is one of those things that really takes forensic reading. You know, you can see this and think you got it, but you didn't quite get it. Okay, looks like we can proceed. Okay, Mrs. Audra, can you read this one for us, please?
All right. So we have A, 91034, K21.9, B, 93034, K21.0, C, 93037, R12, or D, 91035, K21.9. A 49-year-old patient had several episodes of esophageal reflux and underwent a gastroesophageal reflux test to measure the pH balance, a measure of the degree of acidity or alkalinity. The test was performed with a mucosal attached capsule. The provider provided an interpretation and report. The provider stated the diagnosis as gastroesophageal reflux. What CPT and ICD-10 CM codes are reported?
Thank you, Mrs. Audra. Let's do 2 minutes for this as well.
All right, 2 minutes beginning now.
Thanks. And remember your keywords, coders.
All right, time is up.
Thank you, Mrs. Audra. Let's see what we have in the chat. See a couple different answers. And I see those wonderful keywords. Okay, let's find out. Our correct answer is D. A lot of you got that. That is awesome. I think you guys are doing great tonight. Mrs. Audrey, do you think that too?
I do.
Yeah, you are impressive. You know, in that cheer, we said we can do this. You really can do this. You are doing great. Okay, let's take a look at some keywords here. 49-year-old, esophageal reflux, gastroesophageal reflux test, measure pH balance, mucosal attached capsule, interpretation and report, gastroesophageal reflux. Let's take a look at these code descriptions now. Starting out with A and B, we're going to look at 91034. It's in both of them, so we might be able to eliminate both at once. Let's see. Esophagus, gastroesophageal reflux test. Sounds good so far, huh? Then it says with nasal catheter, pH electrodes placement, recording, analysis, and interpretation. Coders, does this scenario have anything about a nasal catheter being used? Does it mention that? No, it doesn't at all. A lot of you see that. Some are even saying it in capital letters. Okay, yeah, so can't use that code. So we've got 2 out the door already. Awesome. So we need to figure out 91037 versus 91035. Let's take a look. 91037, esophageal function test. Does it say that happened? Tell me in the chat. See anything about an esophageal function test? No, I don't see that either. After it says there's a gastroesophageal reflux test, but again, it's the nasal catheter. So on quite a few counts, that one's out. So let's look at 91035. We have esophagus gastroesophageal reflux test with, look at this, mucosal attached telemetry, pH electrode placement, recording, analysis, and interpretation. So I've got our gastroesophageal reflux test, and we've got this mucosal attached. It doesn't use the word capsule, but we've got enough keywords matching compared with these that this has got to be correct. And then looking at our ICD-10 code, we've got gastroesophageal reflux disease. That's exactly what was diagnosed. So D is our correct answer. Have any questions for me on this, or does it make sense? Tell me in the chat. Most of you got this correct, which is great. All these got it. It's awesome. Great to see that. Okay, I think we can keep moving here. Okay, Mrs. Audra, you're on.
All right. We have A, 94330, 45330. I'm getting really tired tonight. I've been up for a while.
I've been having the same problem.
45331, K62.5, B, 45331, K62.1, C, 45333, Z12.11, K62.5, D, 45305, K92.1. A 20-year-old patient presented to the hospital with a history of bloody stools for 3 weeks duration. The patient was prepped for a sigmoidoscopy. The sigmoidoscopy was passed without difficulty to about 40 centimeters. The entire mucosal lining was erythematous. There was no friability of the overlying mucosa and no bleeding noted. No pseudopolyps were identified. Biopsies were taken at about 30 cm. These were thought to be representative of the mucosa in general. The scope was retracted. No other abnormalities were seen. What CPT and ICD-10 CM codes are reported?
Thank you, Mrs. Audra. Let's do 2 minutes for this one, too.
All right, 2 minutes beginning now.
Thanks. Remember your keywords, coders.
And time is up.
Thanks, Mrs. Audra, and answers are still coming in, so keywords. So just going to watch the chat for a little bit longer. Okay, coders, it looks like most of you came up with B. You know what? You are correct. Awesome. Let's take a look at some keywords and try to sort this out. We've got 20-year-old, bloody stools, sigmoidoscopy, sigmoidoscope, biopsies, no other abnormalities. And looking at the answers, I just see numbers that are near each other in the CPT codes, but they don't help me. I do see all my ICD-10 codes start with a K, except this one also has a Z code in it. So might have to think about that. Okay, let's move through this now. Let's look first at answer D at code 453-00, proctoid sigmoidoscopy, rigid with biopsy, single or multiple. Okay, we've got the biopsy, we've got the multiple. This tells us that biopsies, so we have to code for multiple biopsies. Is this the right scope, coders? Do we need a... No, you got that, Kimberly. You got that, Kristen, Felicia. This was a proctosigmoidoscopy, and we had a sigmoidoscopy, so we've got to read carefully. And in digestive coding, so many of these procedures are done with a scope. Really important that we match up the right kind of scope with the procedure described in this scenario. Okay, Let's keep going now. 45330 and 31. Sigmoidoscopy, flexible, diagnostic, including collection of specimens by brushing, washing when performed. It's 45330. Parent code. Then we have child code 45331 with biopsy, single or multiple. Can I code those together? Ah, I see great stuff in the chat. No, I've got up here a diagnostic description, and I've got here a surgical description, and we even have a parenthetical note that says, don't do it. Okay, so yes, Brenda, it would be unbundling. Right, and you know, our FTRs tell us diagnostic, surgical, we cannot code them, that the diagnostic is bundled into that surgical scope procedure. Okay, so awesome. A lot of you figured that one out. That's great. And here's our parenthetical note that we need to keep in mind here. Okay, so incorrect per parenthetical note, diagnostic and surgical scope. Okay, going on. Let's look 45333. This is sigmoidoscopy. Here's our parent, sigmoidoscopy, flexible, with removal of tumor or tumors, polyps, or other lesions by hot biopsy forceps. Okay, was anything removed? Did they remove a tumor or a polyp or a lesion? Does it say that happened? Nah, not at all. Not at all. Right, Brenda, this was only a biopsy. And so we can't use that one either. So that is taking us back to B, 45331, which is sigmoidoscopy flexible with biopsy, single or multiple. So here we just have the surgical scope, and then we've got K92.1, ICD-10 for melena, which is bloody stool. So that is our correct answer. Any questions for me? You guys did a great job answering all my questions as we went through this. So I really think you pretty well have got this. But tell me in the chat if you got any questions. Looks good. Okay, coders. There's a star troop D for you. Here we go. Mrs. Audra, can you read this one for us, please?
All right. We have A, 91040, B, 91065, C, 82373, or D, 94250. What is the CPT code for a test used to diagnose carbohydrate malabsorption, carbohydrate intolerance, or lactase intolerance? It involves the patient ingesting lactose or carbohydrate feeding followed by collections of exhaled air to measure the hydrogen in the breath.
Thank you, Mrs. Audra, and let's do 2 minutes again.
2 minutes beginning now.
Remember keywords, coders.
And time is up.
Thank you, Mrs. Audra. And some answers are still coming into the chats. Going to keep an eye out. And this is another one where lots of you got this correct. The keywords, as always, are great. You guys are spoiling me on keywords. Here's our correct answer. It's B. So congrats to everybody that came up with that answer. Let's take a look at some keywords. Carbohydrate malabsorption, carbohydrate intolerance, lactase intolerance, collection of exhaled air, measure hydrogen in the breath. Okay, let's look at our codes. Looking at A, 91040, esophageal balloon distension study, diagnostic with provocation when performed. Did that happen? I don't think so. Nah, that's an easy one to eliminate, isn't it? There's nothing that really matches here. Okay, let's look at 94250, expired gas collection, quantitative single procedure. Expired gas, this is exhaled air, measuring hydrogen. Hydrogen's a gas. What do you think? Could we use that? Is that a possibility? You know what? I look up here, and this is in pulmonary diagnostic testing and therapies. This is digestive testing. So it's a different kind of study of what a patient is expiring. And so we've got to, got to exclude that one as well. Looking at C, 82373, carbohydrate deficient transferrin, totally different procedure. Can't use that at all. Looking at D now, breath hydrogen, we're looking for that, or methane test, for example, for detection of lactase deficiency, fructose intolerance, bacterial overgrowth, or oracecal gastrointestinal transit. Now, the specific test that's done here is not in the examples, but that's just an example. Breath hydrogen is what they're measuring, and so B is our correct answer. Anybody have any questions for me on that one? You got it? Awesome. Looks good. Okay. You up for another one? I'll bet you are. Okay, Mrs. Audra, it's all yours.
All right. So we have A, 45384 times 2, 45385 times 3, Z 80.0, K 63.5, Z 12.11. B, 45384, 45385 modifier 59, Z 12.11, D 12.3, D 12.2, Z 80.0. C, 45384, 45385 modifier 59, K 63.5, Z 12.11, Z 80.0, or D, 48584 times 2, 45385 times 3, K 63.5. A screening colonoscopy is performed on a 50-year-old patient with a family history of colon cancer. Multiple polyps were found during the procedure. 2 polyps in the transverse colon were removed with hot forceps cautery. 3 polyps in the ascending colon were removed via snare. Portions of all polyp tissues were to be sent to pathology. What are the correct CPT and ICD-10 CM codes for this patient encounter?
Thank you, Mrs. Audra. This is a lot of code, so let's take 2.5 minutes for this one.
All right, 2.5 minutes beginning now.
Thank you.
All right, and time is up.
Thank you, Mrs. Audra. And my question box, right? I see what all our students have written. Just went crazy on me. Let me get back to it. Okay, I'm okay now. So I see all different answers down here. So I got my work cut out for me here. I do see some really good keywords. I see a comment that this is difficult. If you found it difficult, I hope you did the best that you can. And hopefully after I go through it, it makes more sense to you. If it doesn't, please ask your questions, okay? And here's the correct answer. It's B, and there are those of you that got that. Awesome. Now, I want to take a look at these answers, and the first two codes are our CPT codes. You know what I see? Every answer has 48534, and it has 45385. A and D have multipliers attached. B and C have modifier 59 attached. So once again, once I figure out which is which here, I'm going to be able to eliminate two at once. Okay, now let's take a look at some keywords. We got screening colonoscopy, 50-year-old, family history of colon cancer, 2 polyps on transverse colon, removed with hot forceps cautery, 3 polyps in ascending colon, removed via snare. Okay, let's take a look. Let's take a look now. Let's look. We have 45378, our parent code, colonoscopy flexible, so that's a good start. Okay, this is a colonoscopy. 45384 with removal of tumor, polyps, or other lesions by a hot biopsy forceps. That happened. Okay, I'm liking that. And 45385 with removal of tumors, polyps, or other lesions by snare technique. That happened too. So both of these happened in our scenario. Now, do I need the multipliers or not? We've established these two are the correct codes. Do we need the multipliers? I see a mixed reaction. Alrighty, let's take a good forensic look here at our code description and take a look. Both of these codes have polyp followed by an S in parens, and that means that these codes are good for a single polyp or for multiple polyps, and that we do not need to use multipliers. Brenda, you nailed it. They are listed as S's. Yes, Cindy, you nailed it too. So, with that, A and D are out. I don't have to think about them. And we know that this much is correct. Okay? Or is everybody good on that much so far? Any questions on that part? Got that far. Good, Deidre. Okay, so now we got to sort out these CPT codes. There's quite a variety here, isn't there? So we've got those. They're good to go. It helps to kind of box them off so we look differently. Look at this. We've got Z 12.11 in both. Okay. K, that's not here, up here. Z80 is in both. Okay, this has these D codes, and this has this K code. So we got to do some real forensic reading. I'm going to do a new screen to try to sort out just the CPT part of this, or the ICD-10 rather part of this. So let's look our Z code first. Z12.11, encounter for screening for malignant neoplasm of colon. And then it tells us specifically that it includes encounter for screening colonoscopy, not otherwise specified. That's exactly what happened here. That gets a star. Okay. Now, moving on. when we look in the D12 codes, D12.2, benign neoplasm of ascending colon. Okay, this was a polyp in the ascending colon. And D12.3, benign neoplasm of transverse colon. 2 polyps were in the transverse colon. So that strikes me as pretty good choices as well. So this one is looking good so far. Let's take a look. K63.5, polyp of colon. Not very specific, is it? Not very specific at all. And so I'm eliminating that one because I'm wanting more specificity. Okay, and then looking at Z80, we've got family history of primary malignant neoplasm, and then 0.0, family history of malignant neoplasm of digestive organs. And so that is correct as well. We give that a star. And so with that, B is our correct answer. Now, I've seen some questions popping up in the chat. Let's take a look. Okay, I see Z12.11 is not in Appendix B, so why is it first? Excellent question, Deborah. The Z codes, there are some that are only first listed, and that's what's in that appendix. There are others that can be first listed. This Z12.11 is the reason for the encounter for screening colonoscopy. So it needs to be first. We have another question, or maybe it's a comment, a lot of Z codes are for screening, right? Brenda, their Z codes cover quite a number of things. Screening is one of them. You know, it also, you see here, we also have family history. So they also cover all the various kinds of family and personal histories of various diseases, and some other things as well. But a lot of them are about a reason for an encounter. Oh, and you put here and histories. You got that, Brenda. Is K63.5 for one polyp? Well, it says polyp of colon, so it's worded as one. I've never seen diagnosis codes with multipliers. Have you ever seen that, Mrs. Audra?
No.
No. No. You just don't see that. Okay.
We have one here that says, how do we know if it's a benign neoplasm rather than malignant?
This is great. That's another great question. Okay. For starters, it doesn't tell us it's malignant. Okay. And what I actually did, just to be 100% sure, is I did go index it. And if you go look up polyp, and then you look up colon, there's a whole list of locations in the body, and it directs us for ascending and transverse colon. It directs us here to these codes. And ICD-10 is like that. Sometimes you really need to clarify in that index. I needed to once in my CPC exam. Just the wording wasn't enough of a match for me to be satisfied, but most of the time you won't need to use that in your exam. Okay, did that help? Brenda makes another great observation. They're being sent to pathology for confirmation, which goes with my earliest statement that it doesn't tell us they're malignant. Yeah. Deborah, so you need to go to the index first? Not necessarily. But if that's your question with this scenario, that's a place where you can resolve that question. Okay? Any other questions? I had no idea this was going to trigger all kinds of questions, but it's great. Okay, coders, it's just after 10 o'clock. Our next scenario, it looks like one we can do pretty quickly. Are you up for one more before we go to post-class? I would love to do one more with you. Yeah. Yeah. All righty. One more is coming up. Mrs. Audra, you're on.
All right, so we have A, 36415, E, 83.110. B, 36430, 99195, E, 83.119. C, 99195, E, 80.0. Or D, 99195, E, 83.119. Provider has ordered de-ironing by therapeutic phlebotomy to be performed weekly. The patient is diagnosed with hemochromatosis, and therapeutic phlebotomy is used to avoid irreversible tissue damage. 1 unit of blood is removed weekly. What CPT and ICD-10 CM codes are reported for each weekly visit treatment?
Thank you, Mrs. Audra. Let's do 2 minutes for this.
2 minutes beginning now.
Remember your keywords, coders.
All right, and time is up.
Thanks, Mrs. Audra, and we do still have answers coming in, so coders, keep at it, give us your answers. And your keywords. Okay, I see again keywords that are right on target, and I see a few different answers. So we need to dig in here, and let's first look. D is our correct answer, and more of you came up with that than the other answers. So that is great. Now these answer choices really raise questions for me. Okay, I see this 99195 in 3 answers. And look at this, these ones in the 30,000 series, 36, 415, and 430. Do I need that? Does this tell the story? Is this enough? I don't know. And then all that I see in the answers is that they all start with E and they're all in the 80s. So just they raise questions for me. They don't tell me anything, you know, they don't give me a specific direction to move in. But I know I need to answer those questions. Let's look at some keywords. De-ironing, therapeutic phlebotomy, weekly. Hemochromatosis, therapeutic phlebotomy again, 1 unit of blood. Okay, let's look at some code descriptions here and figure this thing out. We've got, for A, 36415, collection of venous blood by venipuncture. Is that what happened here? Is this, are they drawing blood here? Yeah. No, right, you got this. Yeah, this is like a blood test. So, nah, wrong procedure. Answer B, transfusion, blood or blood components. Is that going on here? Did this person receive blood? No, you got this also. That one's out. Okay, so let's see what 99195 is. Look at that, phlebotomy, therapeutic. I'm liking that. And that tells me this boils down to our ICD-10 codes, okay? If we look at E80.0, disorders of porphyrin and bilirubin metabolism, and then hereditary erythropoietic porphyria. That's not what happened at all. Is that diagnosis up here? Not at all. So that one's out. This is a good code, however. We're going to hold on to that. And looking down here, E83.119, hematochromatosis, unspecified. You know what? I'm getting a message that poll results are showing, and I have a message in the chat. Somebody, Stika, saying she can't see my screen. Brenda lost the whole question.
Interesting.
What do you see, Mrs. Audra?
I see the poll question too, and I'm not sure exactly what happened. Interesting.
Yeah. Okay, let's, you have the PowerPoint up, right?
Just give me 1 second and I will...
Wait a minute. You know what? Now students are telling me we're back. It came back. And all I did, I clicked on polls and closed it. I didn't touch the poll. I don't know what happened. But it looks like we're good to go. We dodged a bullet. Thank you, coders, for letting us know that there was a problem and for letting us know that it came back. Did you guys see anything of this presentation on this one? Do I need to backtrack all the way? I think I'd better, just to be sure. Okay, so looking at 36415, collection of venous blood by venipuncture, that didn't happen. Okay, so that one's out. Wrong procedure. Now looking at 36430, transfusion, blood or blood components. Is this patient receiving a transfusion? What do you think? Tell me in the chat. No. Right, you got that. No, so that one's out. So, looking here, 99195, phlebotomy, therapeutic. Therapeutic, phlebotomy, perfect match. I'm liking that code. Now I look, before I look, let's look here at C and D. These match, okay. So we know we got that one nailed. And it all boils down to our ICD-10 code. So if we look at E80.0, hereditary erythropoietic porphyria, that's not mentioned in our diagnosis at all. Our diagnosis is hemochromatosis, so that one's out. And if we look here, E83.119, hemochromatosis unspecified. That is exactly what happened, what the diagnosis is, rather. And so that is the reason why D is our correct answer. Anybody have any questions for me on that? Or does it make sense? A lot of you got this one correct. Okay. Looks good. And It is now 10:14. We had a request from one of our accelerators to go back to, is this what you needed? Is this what you need to shoot, or do you just want to screenshot the scenario itself? Tell me in the chat. Okay, I don't see an answer in the chat. You're good. Okay. Anybody else need to me to go back to anything before we call it a night on the time scenarios? Sika, you are most welcome. And don't leave. Mrs. Audra is going to go over the post ones. Oh, and we have somebody testing on Saturday, Munyata. We are sending you all the best wishes, best vibes. Everybody here, we've got to think of Munyata on Saturday, that she does her very best. And Munyata, there are best wishes going into the chat. Good luck. Yeah, awesome. And Brenda says, you are AMCI strong. Woohoo! Yes, you are. Yes, you are. Okay, so you must let us know on Facebook how it goes, okay? All righty. Okay, we're going to wrap up now on the time scenarios. You guys did great. You're getting to be stronger and stronger coders, and I love seeing that. You've had great questions. You worked really hard. Mrs. Audra, you did a fantastic job. And Mrs. Audra, she's going to go into the post-class now. So thank you all. And Mrs. Audra, are you ready to change presenter?
In just a moment, I will be, yes.
Okay, so tell me when.
So in the meantime, go ahead and start doing your post-class scenarios, and I will see you in a little bit.
Yupper.
I'm ready to go ahead for post-class.
Okay. You've got the screen, Mrs. Audra.
All right, thank you.
Okay, Munyata's asking, where is it? If you got the pre-class in the handouts, it's part of that same handout. Just, go to where the pre-class ends and the post-class is right after it.
Yes, pre-class and post-class is on the same sheet. So I'll go ahead and do those. And I will give you till about 1/4 and then I will go over them. Okay, somebody says they're already ready. I'm gonna go ahead and okay, we have a bunch of people that are ready.
Go for it, everybody.
They must have already. These must have been our early birds that came in early before I got in.
Yeah, we got to wait for the people that are just starting it.
Yeah, there's some of them came in late. We have to give them time to get theirs done.
Yeah. So anybody that already has post done, take out that CPT book and work on your chun, work on your tap in your ICD-10. Perfect opportunity. Some time. Brenda says restroom break. It's a perfect opportunity for that. Move your body around. We've been sitting still for quite a while. It's good to get that oxygen going back into your brain. So we will resume when it's time, and we thank everybody for waiting for the students that need the time to work on this. Okay?
All right, who needs to have more time to get their scenarios taken care of? Anybody?
Tell us in the chat, please.
All right, I have one ready. All right, looks like pretty much everybody is ready to go. I think because some of you came in and did them early before 7:30. That's all right. Okay, I'm going to go ahead and go over these. Okay, starting with number 1, we have A 00540 AA 00540 QZ, B 00540 QK 00540 QY, C 00541 AA 00540 QZ, or D 00541 QK 00541 QX. A 40-year-old received general anesthesia for an open pleura biopsy. An anesthesiologist medically directing 2 other cases and medically directs a CRNA on this case. What are the appropriate codes for both providers? Please put your answers in the chat. Looks like we're divided on this one. So, okay. Let's go over this one. All right, so we only have 2 codes, 00540 or 00541. I see a couple AAs, I see QKs, QY, QZ. All right, so to find out what's going on, I went into my scenario, and the keywords were 40-year-old, general anesthesia, open pleura biopsy, anesthesiologist medically directing 2 other cases, and medically directs a CRNA on this case. Code both providers. All right, so looking at the code descriptions, which include the modifiers, I decided that C was incorrect. There is no mention of 1 lung ventilation. So C is incorrect. This also leaves D is incorrect for the same reason. 00541 includes 1 lung ventilation in the code description. So that's not correct. So now we have A and B, and we need to know what the anesthesiologist did and what the CRNA did. So A was incorrect. AA is for anesthesia by anesthesiologist. I don't see that in here. So looking at B, this one is the correct one. Anesthesiologist medically directing 2 cases. CRNA being directed by the anesthesiologist. Does everybody understand why B is the correct answer? Okay. Somebody says no. What do you not understand? Oops, I lost my question box. What is QY? What is the modifier QY? That you have to go into your HCPCS book. That's where the HCPCS book comes in. That's where you're going to find these codes. Okay? And in the AAPC HCPCS, these codes are found on the inside back cover. The second column, you have QX and QY, QZ, okay? All right. Yes, the QY is correct because the CRNA is being directed by the anesthesiologist. So that's what makes B the correct one. Does it? All right. Yes, and Deborah says CRNA directed by anesthesiologist. Yes. Modifier QY is correct for one CRNA, but here more than one medically directed. The anesthesiologist was doing multiple. Okay. The CRNA only did one in this scenario. Now do you understand? Sika? Not really? Okay. The anesthesiologist was medically directing 2 cases. Okay? Plus, on top of those 2 cases, he was also medically directing a CRNA. In this case. This case was a open pleural biopsy. That's one case. He was also medically directing 2 other cases on top of this case. Okay? Brenda says there is a very good lecture on these by Mrs. J. Yes, that's why you need the QK. So my suggestion is on the anesthesia, go ahead and rewatch all of those lectures, and even if you have to watch it more than once, something might click at some point. Okay? Okay. All right. We're going to go ahead and go on to the next one. We have A, 01967 00840, B, 01962, C, 01968, or D, 01967 01969. Patient is admitted in labor for delivery. She receives a labor neuroaxial epidural for a vaginal delivery. The baby goes into fetal distress and a cesarean section is performed. Following delivery, the patient starts to hemorrhage. The physician decides with family approval to perform a hysterectomy. Code the anesthesia service. Please put your answers in the chat. Okay, so I see mostly D's in here, so okay. I see an A, I see a couple B's, mostly D's though. All right, so we're going to go ahead, go over this one. All right. Okay, so we're pretty close together on code, so that's kind of good. I like it, basically because it reduces page hurt. So I see A has a 00840 in it. D also has 2 codes in it. My keywords are admitted in labor for delivery, labor neuraxial epidural, vaginal delivery, fetal distress, cesarean section performed, patient starts to hemorrhage, physician decides, hysterectomy, anesthesia services. All right, so the code descriptions tell me that B isn't incorrect. This is anesthesia for urgent hysterectomy following delivery. I just didn't think that was, after looking at all the codes, I didn't think that this was a good enough code, so I eliminated that one. C was incorrect. This is anesthesia for cesarean delivery following neuraxial labor nausea anesthesia. Again, I just didn't think that one was correct after looking at 01967 as well. So it was at this point it was between A and D, and A was incorrect. This is neuraxial labor analgesia anesthesia for planned vaginal delivery, anesthesia for intraperitoneal procedures of the lower abdomen. I don't see that language 00840 anywhere in this scenario. So that means D would be our correct answer. Neuraxial labor analgesia anesthesia and anesthesia for cesarean hysterectomy following neuraxial labor analgesia anesthesia. All right. So does everybody understand why D is the correct answer? Yeah, somebody mentioned that add-on code. Yeah, C is an add-on code, so that can't be used either. So great job. All right, we're going to go ahead and move on. A 01173 P3 99100. B 27226 01190 P3 99100. C 01173 P4 99100 modifier 51, or D 01170 P4. An anesthesiologist provided general anesthesia for open repair of a fractured pelvis column involving the acetabulum for a 74-year-old patient. Further documentation for this patient includes severe hypertension and uncontrolled diabetes. How should the anesthesiologist report her services? Please put your answers in the chat. All right, looks like we have pretty much A in everybody's answer. So, okay. Gonna go over this one. I see A and C share the same first code. I see 99100 in 3 answers. I see P4 a couple times. I see P3 a couple times. So that's going to be significant, which modifier is the correct one. My keywords are anesthesiologist, general anesthesia, open repair, fractured pelvis column involving acetabulum for a 74-year-old, severe hypertension and uncontrolled diabetes, anesthesiologist services. All right, so code descriptions, B was incorrect. We're only coding for the anesthesiologist. So B is automatically incorrect. So now we need to decide 01173 or the 01170. And looking at both of those codes, I decided that the P4, patient with severe systemic disease for the constant threat to life, for the P4, I don't see where it's a constant threat to life. We have severe hypertension and uncontrolled diabetes, severe systemic disease, but the constant threat to life, I just don't see that in the scenario. So I eliminated that one as well as D, and that leaves A as the correct answer. Anesthesia. Okay, I went and put this one is I had the wrong description in here, and it should say, nice goof, because I had originally had the wrong answer up there until I double checked it. 01173 is I gotta find it.
I've got it, Mrs. Audra. It's on page 59.
Thank you.
Uh-huh.
All right. 01173, anesthesia for open repair of fracture or dislocation of pelvis. Okay, so I apologize. That's the wrong answer up there for the rationale, but the code is correct. Does everybody understand why A is the correct answer? Somebody said, would the constant threat to life be in question? You'd have to understand what the diagnosis would end up being and what would be considered. I had it written down somewhere in one of my previous scenarios a couple of weeks ago, and right now I just can't find it. Are there any other questions about this one? And if not, I'll move on. All right, I don't see any other questions. Let's see. Hang on a minute. Let's see. A 00350 P2 35800, B 35800 modifier 47, C 00350 P2, or D 00350 modifier 47. Dr. Burns, a surgeon, provided regional anesthesia and completed an exploration for postoperative hemorrhage in the neck on a 55-year-old patient with moderate cardiovascular disease. How would Dr. Burns report his services for this case? Please put your answers in the chat. right, let's see. All right, I see mostly B's in here. I see a D, I see a C. All right, so let's move on. All right, so we only have 2 codes to work with here, 35800 and 00350. Modifiers are going to be a big help as to the determining factor of which code is the correct one. Keywords are Dr. Burns, regional anesthesia, exploration for postoperative hemorrhage, neck, 55-year-old, moderate cardiovascular disease. All right, so code descriptions. A was incorrect. This is anesthesia procedure for major vessels of the neck not otherwise specified. I don't see that anywhere in here. We're looking for postoperative hemorrhage exploration. So with regional anesthesia. So that eliminates that one. C is incorrect. Anesthesia for procedures of major vessels in the neck not otherwise specified. Again, not correct. Again, not correct. And B, 35800, exploration of postoperative hemorrhage with anesthesia by surgeon. Because it does say that the surgeon provided the regional anesthesia and did the exploration. All right, does everybody understand why B is the correct answer? Yes, Brenda, absolutely. Modifiers are dictating this one. So if you guys can keep in mind when you see something like this, you can probably eliminate at least 2 of them right off the bat just by looking at the modifiers first. Hang on a minute. Surgeons don't use on the whole. Most of the time, surgeons are not going to use the anesthesia codes, but in this case, it does say that he provided regional anesthesia. It says Dr. Burns, a surgeon, provided regional anesthesia and exploration for postoperative hemorrhage. He did both of those. So yes, the modifier 47 would be applicable. Otherwise, no. All right. If we're good, we're going to go ahead and go on. All right, so we have A 00170P1 B 00102P1, C 00102P1 or D 00170P1. A healthy 11-month-old patient with bilateral cleft lip and palate undergoes surgery. The surgeon performs a bilateral cleft lip repair single stage. Code the anesthesia service. Please put your answers in the chat. All right, looks like we have answer C. I do see 1B in here. All right, so I'm going to go ahead and solve this one. It's just between 3 codes again. We need to know if the 99100 add-on code is applicable or not. We have 00170 and 00102. So my keywords are healthy 11-month-old, bilateral cleft lip and palate, surgeon, bilateral cleft lip repair, single stage, anesthesia service. All right, so descriptions say that, hang on a minute. Okay, the code descriptions tell me that B is incorrect. This is missing the anesthesia code for a patient that is less than 1 year old. We have an 11-month-old. Okay, so that would make it less than 1 year old. This one's missing that modifier. You need the 99100. Okay, D is also missing that, so I'm going to eliminate that one. So now we have A and C as to whether or not which one is the correct anesthesia code. A was incorrect. This is anesthesia for intraoral procedures, including biopsy, not otherwise specified. Whereas C is the correct answer. Anesthesia procedure for plastic repair of cleft lip. You need the P1 modifier for a normal healthy patient, and anesthesia for patients that are less than 1 year old or older than 70. All right, everybody understand why C is the correct answer? Yay, somebody got them all right. Could I do the answers for pre-class one more time? Absolutely. Just one more, just give me 1 second while I grab them out of my notes. Okay. The answer to number 1 was D. The answer to number 2 was A. The answer to number 3 is C. The answer to number 4 was A. And the answer to number 5 was B. And for the answers one more time for post-class, the answer to number 1 was B. The answer to number 2 was D. The answer to number 3 was A. The answer to number 4 was B. And then the answer to number 5 was C. Yay, Brenda got them all correct. Both parts. You're welcome, Cindy. You're welcome, Felicia. Good night, Troopty. You're welcome, Ying.
You're welcome, Troopty.
Brenda said she learned something new.
Woohoo! Awesome, awesome.
I love those.
Yeah, I do too.
Yay!
I do too.
All right, we're going to close up the webinar and say good night.
Yes,
So we'll see you guys next time.
Thank you, Mrs. Audra, for a great job with pre and post class, and thank you, coders, for giving it your all, and we'll see you next week.
All right, good night, everybody.
Remember Friday night group study integumentary. Bye-bye.
Bye-bye.